Gap cover is not a medical aid. It's an insurance policy that covers many of the gaps or shortfalls that your medical aid does not cover when being treated in hospital and for certain outpatient procedures. All medical aids set a predetermined amount that they will pay towards the cost of any given treatment. This is known as the Medical Scheme Tariff or MST. Depending on the medical aid option you are on, your medical aid will pay for your treatment costs up to a maximum of 100, 150 or possibly 200% of your medical aid's tariff amount. When being treated, however, surgeons, anaesthetists and other specialists are free to charge whatever they like, and this is often substantially more than the medical scheme tariff. When this occurs, you become liable for that treatment cost shortfall. Gap cover takes care of these unpaid medical expense shortfalls. Imagine you are hospitalized for a routine operation. Your surgeon charges 34,000 Rand for his services and the anaesthetist 18,500 Rand. Your medical aid, however, only pays out 19,500 Rand for this type of operation. This results in a shortfall of 33,000 Rand, which you would be required to pay. This is the gap, the unpaid shortfall that your gap policy covers. We provide the choice of 3 gap cover options. Universal Gap Cover provides the most comprehensive medical expense shortfall cover, along with extensive financial protection for a wide range of health risks. Essential Gap Cover offers affordable cover for the most frequent medical expense shortfalls. And Optimal Gap Cover offers high levels of cover and affordability to match the needs of individuals and families where all lives insured are under the age of 42. All 3 gap policies can be taken as individual or family cover options. The family option insures the principal medical aid member and all family listed as medical aid dependents. Your gap cover policy is designed to cover the medical expense shortfalls that arise from in-hospital procedures, but there are approximately 60 out-of-hospital procedures such as CT and MRI scans that are covered as well, and these are listed in your policy document. Universal Gap Cover provides cover for in-hospital doctor and specialist charges and the listed outpatient procedures of up to 5 times the medical scheme tariff. The Essential Gap policy covers up to 3 times the medical scheme tariff for these same in- and out-of-hospital medical expense shortfalls. And the Optimal Gap policy covers up to 4 times the medical scheme tariff for these medical expense shortfalls. In each case, the shortfall covered is calculated as the difference between the total cost charged by your medical practitioners and the amount paid by your medical scheme. The Universal Gap policy provides cover for shortfalls on consultation fees charged by an admitting medical practitioner prior to or following in-hospital surgery. The shortfall covered is the difference between the admitting medical practitioner's consultation fees for pre- and post in-hospital surgery and the amount paid by your medical scheme. To qualify for this benefit, the medical aid must pay a portion of the admitting medical practitioner's fees. The consultation must occur within 30 days before or after surgery. The surgery must be conducted in a hospital's operating theatre. The Allied Professionals benefit covers the shortfall between what the allied professional has charged and what the medical scheme has paid for in-hospital care following an associated in-hospital procedure. The benefit provides up to 2,500 Rand per policy per year for these allied professional shortfalls. These shortfalls are only covered if the medical scheme covers a portion of the cost from the hospital benefit and the treatment is part of the associated procedure, is recommended by the attending specialist, and is performed by the allied professional in hospital. All three policies provide cover for what are called co-payments. These are amounts charged by your medical aid that require you to pay upfront to access certain facilities and treatments. Typical co-payments charged by medical aids would be R1,800 for hospital admissions, R5,500 for scans, and up to R17,000 for joint replacements. Your GAP policy takes care of these co-payments. All three GAP policies provide up to R39,500 per policy per year for medical expense shortfalls that arise from the use of robotic machinery during in-hospital operative treatment. All three GAP policies also provide emergency room cover of up to R26,700 per policy per year for accident-related treatment in a hospital casualty facility or by a GP where there is no hospital within a 30-kilometre radius. The universal and essential GAP policies provide cover for emergency treatment up to R2,950 per policy per year for children younger than 11 in a casualty facility. The universal and optimal GAP policies will also cover co-payments that result from using a hospital or service provider that is not listed as a designated service provider or part of your medical aid network. This benefit is subject to a maximum of R16,800 and up to 2 claims per policy per year. Universal and optimal GAP cover include an MRI, PET and CT scan sub-limit benefit that pays in part or in full for the cost of these scans when the medical aid sub-limit has been reached, up to a maximum of R5,000 per individual claim and up to R16,000 per policy per year. Where a co-payment is due for cancer treatment costs that exceed your medical aid's cancer limit, the Universal GAP policy will cover this amount, subject to a maximum co-payment amount of 25% of the treatment costs. Your Universal GAP cover also provides cover where the treatment cost limit imposed by your medical aid is exceeded and they won't fund further treatment. This benefit will pay 20% towards further treatment costs and can be used for general treatment costs or for biological and other specialized cancer treatment. The universal and optimal policies also cover up to R46,000 per policy per year for shortfalls on internal prosthesis and artificial joints, where the medical aid's annual limit has been exceeded or when the medical aid charges a co-payment. Internal prostheses are defined under your policy as devices that are placed inside the body during a medical procedure to permanently replace a body part or to improve a loss or reduction in bodily function. Typical examples of these are artificial joints and implanted spinal fusion devices. The universal policy also covers stents up to a shortfall amount of R5,000 and pacemakers up to R8,000 for each individual insured under the policy per year. Intraocular lenses are also covered up to a maximum of R6,500 per lens for each person insured per year. International travel cover ensures all benefits under the policy will automatically apply following illness or accident while travelling outside the borders of South Africa. In addition to the medical expense shortfall and co-payment cover we've discussed, your policy provides the following health assist benefits. The Cancer Assist benefit provides R8,000 to cover the unexpected costs that may result from a first-time diagnosis of stage 2 local and malignant cancer. If you are subsequently diagnosed with stage 2 regional and malignant cancer for the first time, you receive an additional once-off payment of R12,000. Alternatively, a once-off benefit of R20,000 is payable for a first-time diagnosis of stage 2 regional and malignant cancer. If your medical scheme has spent R200,000 or more on oncology treatment within 12 months of diagnosis, a further R15,000 is payable for regional and malignant cancer if the insured has already claimed the previous benefits. Accidental dentistry cover provides up to R27,000 per person per year for accidental tooth fracture. Accidental death and permanent total disability cover of R55,000 is provided to pay for costs that may arise in the event that anyone insured by the policy suffers accidental death or injury leading to permanent and total disability. The Violent Crimes Assist benefit is paid in addition to the accidental death and disability cover and provides a once-off payment of R55,000 for death or permanent total disability arising from violent crime. In the event of anyone insured under the policy requiring single mastectomy surgery, Universal Gap cover provides up to R29,000 for cosmetic reconstruction of the non-affected breast. And should you or any insured family member require trauma or bereavement counselling from a traumatic incident, an act of violence that has been reported to the police, or following the loss of an immediate family member, we will pay up to R950 per session to a maximum of R32,000 per year. This is subject to counselling commencing within 6 months of the traumatic event and continuing for a period no longer than 6 months thereafter. The Medical Aid and Gap Policy Premium Waiver benefit pays out a benefit of 12 times the combined medical aid and gap cover monthly premiums up to a maximum of R130,000 in the event of the policyholder's accidental death or permanent total disability. Please refer to your brochure or contact us to discuss which gap cover option works best for you and your family. It's important to note that in order to qualify for cover, the procedure or treatment in question must be approved by your medical aid. Regulations place a maximum combined claim limit of R219,800 per person for any 12-month period, but this only applies to the medical expense shortfall benefits. Your enhanced cancer, accidental dentistry, accidental death and disability, and medical aid and gap policy premium waiver benefits are all payable in addition to this regulated annual limit. Day-to-day medical costs such as GP visits and medicines are not covered, and as with any policy, there are a list of items that can be classified as general exclusions, such as claims resulting from nuclear weapons, waste or warfare, injuries sustained while participating in a criminal act, speed tests such as motor racing, alcohol or drug use. There are also specific treatments such as cosmetic surgery that are not covered, and this full list is detailed in your policy document. It is important to pay careful attention to the waiting periods we apply to curb abuse of the policy, which, unchecked, would lead to much higher premiums becoming payable by you, the policyholder. Unlike other gap providers, we do not apply a general waiting period, meaning that from the outset you are covered for all of the policy benefits, except those that have specific waiting periods. Your policy is not designed to cover treatment costs for pre-existing medical conditions, so there is a 12-month waiting period for cover relating to any conditions that existed in the 12 months prior to the inception of the policy. Pregnancy and birth-related claims are regarded as pre-existing conditions in the first 12 months of cover. In addition to the standard benefits provided by your gap cover policy, you have the option to extend your cover for cancer treatment, an area of treatment that can frequently cost more than the cover offered by medical aids. Extended cancer cover offers an optional 132,000 or 264,000 Rand of additional cover. These amounts are paid out in the event of a first-time diagnosis of cancer. Although the benefit is intended to assist in covering the costs of medication and treatment, this can be used to cover any costs that arise as a result of this diagnosis. The extended cancer cover is an optional benefit covering all individuals and family members on your medical scheme under the age of 65. This benefit is subject to a 6-month waiting period and 12-month pre-existing condition exclusion. When claiming, please contact Zestlife using the contact details provided in your welcome pack. We'll send you a claim form and instructions on everything we require from you, but please note that you need to submit your claim within 180 days of being booked in for the procedure or medical event you are claiming for. Claim payments can be made to you, the policyholder, or directly to your medical service providers. And that ends our introduction to your gap cover policy. Once again, please study your policy document and contact us if you have any questions or would like to know more about our other health insurance policies. We look forward to providing ongoing gap cover for you and your family. Thank you for watching.